my name is Letlow, and I am doing a presentation on electroencephalograms, also known as EEG. So what is EEG? EEG is a non-invasive form of neurophysiological monitoring that uses electrodes placed on your scalp to record the bioelectric activity of your brain. And this electrical activity is produced from postsynaptic potentials that generate dipoles in the extracellular space surrounding pyramidal neurons. Each EEG signal represents the difference in electrical potential between a pair of recording electrodes, and these changes are plotted over time. And you can see these changes plotted over time at the top of the picture below, represented by the squiggly line, and this is created from the pair of electrodes that you can see on the skull in the picture, and below the left electrode is a excitatory postsynaptic potential, and you can see positive ions close to the skull, and there would be negative ions near the bodies of these pyramidal neurons, and it will create a dipole that this electrode will measure as a positive charge. And on the other side, the right side, we have an inhibitory postsynaptic potential with negative ions at the base of the skull and positive ions near the bodies of the neurons, which creates a dipole that this electrode will record as with a negative charge. Some factors that may modify the original signal are the conductive properties of the tissues, such as conductive properties of bone, the orientation of the electrical generator to the recording electrodes, and the conductive properties of recording electrodes and scalp electrodes. So the clinical role of an EEG, health professionals use EEGs to assess physical alterations of brain activity. Now, many of these changes in brain activity are non-specific, but some can help indicate epilepsy, herpes, simplex encephalitis, sleep disorders, and metabolic encephaly. These can be used due to the EEG's inexpensive cost, its non-invasive nature, and its great temporal resolution. It's used in many medical practices, such as clinics, epilepsy monitoring units, emergency rooms, ICUs, sleep studies, and operating rooms. So montages are very important in EEGs. They are logical, orderly arrangements of EEG signals or channels that are created to display activity over the entire head to provide lateralizing and localizing information. Montaging can be there's two types of montages, bipolar and referential. Bipolar montages can be oriented in different ways because they are connected in chain-like sequences, as you can see. And some common types of bipolar montages would be longitudinal bipolar and transverse bipolar. The other type of montage is a referential montage, and this designates an electrode or two electrodes as a reference electrode, and then every other electrode that is used in the montage is compared to those reference electrodes. In this picture, you can see the reference electrodes are placed on A1 and A2, and the other electrodes that are placed on the scalp are compared to the reference electrode on their ipsilateral side. Now, an important aspect of an EMG that everyone needs to know is how to read an EMG. And in order to read one, you need to know there's three important aspects: the amplitude of the signal, the frequency of a signal, and the distribution of a signal. Amplitude of EEG signals are designated as either high, medium, or low. High being above 50 millivolts, medium being in between 50 to 20 millivolts, and low being below 20 millivolts. Frequencies are some of the most important criteria in determining abnormal EEGs, and the common types of frequencies that are seen in EEGs are delta waves, theta waves, alpha waves, and beta waves. Delta waves have frequencies between 0 and 4 hertz, and they're present when a patient is in stage 3 and stage 4 of sleep, or also known as deep sleep. Theta waves are between 4 and 8 hertz, and they are also present when a patient is asleep, but they're also predominant when someone is experiencing drowsiness. Alpha waves are between 8 and 12 hertz, and these waves are present when the patient is awake with their eyes closed. However, the patient has their eyes open, these waves disappear. Beta waves, they are between 12 and 30 hertz, and they are present when the patient is awake and alert with their eyes open. These are predominantly in the frontal lobe, but they're seen in all cortical regions. Now, lastly, we have the distribution of EEG signals. They can be distributed 3 ways: generalized, lateralized, or localized. Generalized distribution means that the signal is distributed over the entire area of the scalp. There's no specific area that the signal is coming from. Lateralized means that it'll be local to one hemisphere of your brain. So it'll present itself on the EEG screen as either being the entire upper portion of the screen or the entire bottom portion of the screen. The entire bottom half of the screen or the entire upper half of the screen. For localized distribution, it's referring to a specific spot on your head. So only one electrode will be producing this signal. However, you'll see it multiple times because the electrodes are paired up with other electrodes multiple times. For known diseases that present normal EEGs, this includes tumors and epilepsy. About 10 to 15% of tumors are known to have normal EEGs, and this is most likely due to a couple reasons. Either the size of the tumor, it's just really small, or the distance the tumor is from important cortical and subcortical regions, or that the tumor just isn't affecting any subcortical or cortical functions. For epilepsy, about 25 to 30% of epileptic patients produce normal EEGs of normal routine EEGs, and about 10% of epileptic patients produce normal activation and serial EEGs. Now, for the causes of an abnormal EEG, there's 2 types of causes: extracranial and intracranial. For extracranial causes, these are usually due to alterations of the cerebral metabolism. Examples that can cause this are hypoglycemia, renal and hepatic disease, malnutrition, and drug overdose. For intracranial causes, these are usually due to alterations in cerebral function, and some examples include brain diseases and injuries that cause vascular, degenerative, infectious, and traumatic space-occupying lesions. Finally, we have EEG and its use in anesthesia. So whenever you're doing whenever you're using EEG for spinal surgeries, it's most likely going to be used to determine the depth of anesthesia a patient is in anesthesia. And one way to measure this is with a burst suppression ratio, where you take the ratio of a normal EEG signal and compare its normal signal to a suppression signal, which is a flat line basically. And this ratio is scored with 1 being no signal and 0 being fully active. There's another way and this can only be recorded when a suppression signal is present. Another way to measure this is BI spectral index, which uses an algorithmic analysis of a patient's EEG to measure their level of consciousness. This does not need a suppression signal to be measured, and in the picture that's shown on the slide is this index range, or the bispectral index range. And as you can see, between 180 is a patient that is awake, between 60 and 40 is a patient that has been given general anesthesia, and a patient that is at 0 and he's an isoelectric EEG. Just like a burst suppression ratio at 0, it shows at 1 it shows no activity. And these are my references that I used to make PowerPoint. Thank you.